My name is Dr. Brandon Thornberry. I'm one of the veterinarians partnering with your veterinary hospital, and we're going to give an overview to our approach to pain management from a veterinarian's point of view, inviting you into this mindset to where you can ask really good questions to your veterinary team about your pet if they're experiencing some evidence of pain. So the first thing we want to start off with is just some general observations at home, because that's where things start, right? We have a great sense of a pet in the exam room, but that's only a short period of time throughout their day. And potentially even taking videos of what you're observing at home can be really beneficial whenever you bring your pet into the veterinarian. Things to observe, certainly are sometimes even subtle changes or subtle transitions. So if they're slow to rise or slow to fall, they're tending to lean on one side. If they're tending to lean kind of forward at rest, kind of off their back legs, it's not always as obvious as a pet holding up a leg and not wanting to put weight on it. Another common thing that we can kind of see is that a pet that's really painful on their paw, if you think about stepping on something sharp, you're going to lift it up pretty high, and that probably means that your shoulder feels good, probably means your elbow feels good, but your paw doesn't feel good, right? If you really have a painful hip, you can't really lift your leg up very high, and so typically that limpingness or that holding that leg up is going to be a lot lower to the ground because it hurts to kind of lift it up or hurts to flex that knee. So sometimes the higher up they hold the leg, the lower on the leg that ends up being the issue. Some other not so common ways that pets show us that they're in pain, especially with cats that are infamously stoic through lots of different changes, are licking at the area of concern, right? So a pet that's licking or fixating on a joint that hurts might be their first indication that a joint hurts, rather than manifesting with actually lifting that leg up and showing that it's uncomfortable or not bearing weight on it. Another aspect with cats in particular, they might develop mats in hard to reach places because it hurts to bend and reach that area to groom really thoroughly. So noticing mats in places like the back legs or areas along the back might be a manifestation that there's pain somewhere. Another common reason that we see in cats are if they're urinating or having bowel movements outside the litter box. It potentially could be due to arthritis. Either just the effort of climbing over a tall lid might be too uncomfortable, and so therefore they're seeking out other easy places to have their bowel movements or their urinary habits, or that litter box is placed in a hard to reach place like the top floor where they're having to scale a bunch of steps, and therefore their joints hurt, so they're going to seek out something more convenient. Or your dog's having constipation because it hurts to position to have a bowel movement, and that's due to back pain or kind of lower leg or back leg pain. So those are the common things to observe for. In terms of diagnostics, usually laying our eyes on a pet with a thorough physical, doing x-rays of indicator are always a really good test. Some of these pets are really uncomfortable and we're trying to get them into positions to really view the bones or the areas of interest, and so sometimes doing some sedation either ahead of time at home or during the visit or even injectably can be really beneficial to allow your pet to relax and be comfortable during positioning for x-rays. In terms of treatment generalities, there's usually two main buckets. There's the holistic bucket, things like fish oils and omega-3s, glucosamine, chondroitin, things that help support joint health, especially for treating arthritis, that can be beneficial. Additional things like weight loss and getting your pet down to an ideal body condition can really pay dividends to your pet's ability to have comfortable joints. When we tip over into more pharmaceutical or kind of medication approaches, there are a number of options, from anti-inflammatories in the same class as ibuprofen, but we don't give ibuprofen to dogs. We can give other things that are similar. We can give other anti-inflammatories. There's even some newer products available for cats that are injectable antibody treatments that can block pain signals for a prolonged period of time and avoid you having to give medications on a regular basis. Pain can be tackled in a number of different ways, from medications to holistic approaches, but wanted to give you that overview of our approach to a pet that's uncomfortable.